You're listening to Well Within 10, a bite-sized approach to working on your wellness. 10 minutes of wellness thought leadership from experts across the country, hosted by me, Stevi Carr. Today we're chatting with Dr. Sarah Bartlett, gynecologist working for the Christ Hospital with a special interest in wellness and comprehensive care, including hormone therapy. We're going to talk about that today. Thank you so much, Dr. Bartlett, for being here today.
Thanks for having me.
Great. So what are we going to be chatting about?
So I have chosen to focus my career in my office on taking care of women outside of pregnancy. And so one of the things I hear constantly is questions and concerns about hormone therapy and if it's right for me and is it safe for me. And I think women just really want to live happier and healthier lives, and hormone therapy for some women can be a part of that. So I think we've got lots of information to share on that.
Wonderful. Well, I'm excited to dive in. This episode is powered by the Christ Hospital. For more than 130 years, the Christ Hospital has been dedicated to providing the best, most compassionate care for the community. By continually reimagining what healthcare can be, Christ has become more than just a hospital. And today they are an extensive network of 6,500 employees, 1,200 physicians, and 600 volunteers, serving more patients in more than 100 locations throughout the greater Cincinnati area. Learn more on shop.wisewellnessskill.com to learn more. So Sarah, let's go ahead and dive in. Can you just share a little bit about hormone therapy and is it safe?
The answer is mostly yes, and sometimes no, but it's certainly a complex topic. So, everybody's always afraid of cancer. That's the thing that comes up most. And I think that's legitimate, but there's a lot more to it. So I like to kind of explain the history behind hormone therapy. So midway through the last century, everybody was on hormones, whether it was birth control pills when they came out or hormone therapy at much different doses than we use today. And then something happened in the 1990s where there's a big study called the Women's Health Initiative. Many, many women were studied, lots of data came out, and for decades, we've been gaining more information from this study back then, and it scared people. And so we went from lots of people being on hormones to almost nobody being on them because all they heard were these very negative things that may have been misunderstood in some situations. So now we're sort of beyond that and taking a step back and looking at, well, what is the real data and what do we know? What we know is that not all hormones are the same. Estrogen, progesterone, oral, transdermal, each responds differently and has its own risk and benefit. We also know that women are uniquely made, and their chemistry and their personal health history, their family history, all of that falls into play in terms of whether they're safe or not. So I always tell women, you need to really discuss this with somebody who's truly expert and up on the literature to determine actual safety. The long and short of it is that many people, including physicians, have misunderstood the data and have assumed that they are unsafe. But in fact, they're largely safe for a lot of women. And it's something that really needs to be discussed and evaluated individually.
Absolutely. And I love your approach to getting to the root of the issue. As a person that, had cervical cancer, has suffered once I got off of birth control, cystic acne, mood swings, a lot of things like that. I know that there's a lot of times that you have people who just want to, put a Band-Aid on it and move forward. And I just appreciate that you're stepping in, and evaluating whether, hormone therapy is safe per individual, understanding this is a very personalized discussion, but also, understanding what the individual benefits could look like. So let's dive in there. What are different benefits from hormone therapy that people, or HRT as it's called? Yeah.
So the big ones we hear about are symptom relief. So mostly what we call the vasomotor symptoms, hot flashes, night sweats, also things like poor sleep, mood changes, mental clarity. Hormone therapy, specifically estrogen, can absolutely help those things. Now, you weigh the risk and the benefit and all the individual things I mentioned, but it absolutely helps that. It is also significantly helpful for bone health, preventing osteoporosis later in life, which almost all women are at risk for when they lose their normal estrogen at the time of menopause. There's some data about it being helpful for heart disease and even dementia, although we have to be careful because we don't give it for heart disease prevention. We don't give it for dementia prevention. But when you're looking at big picture and nuanced goals in terms of patient care, those are things to consider. And those are evolving things. Yes, exactly. So, so there's some very clear-cut benefits, and then there's less clear-cut things to consider. People always ask me about sex drive and libido, and I think that is a really complicated topic, and there is a role for testosterone in that, but that's a topic on its own. It is something that is done, but is far more complex than your traditional estrogen and progesterone. Now, the other thing I wanted to mention, though, is when I keep talking about estrogen and progesterone, and a lot of times those are patches or pills or creams, vaginal estrogen, though, is super safe, underutilized, I think, because it gets clumped in with other hormones and people sort of become afraid of it as well. But even women who are not a candidate for whole body estrogen, they are still almost always candidates for vaginal estrogen. And the idea behind that is very little gets absorbed into the bloodstream. So you don't get it to your breast and your heart and other organs. It stays in the vagina, where it is very effective for things like dryness, pain with sex, urinary symptoms. So I think that's been underutilized, and people are starting to really recognize the safety and the benefit of giving that to almost all women.
Oh my gosh, that's incredible. We, spoke to Dr. Shaw previously about pelvic floor health and from urogynecology perspective. And I love that there's this integration of, the conversation on what are different things that we can do that may not be, necessarily there's not, again, a one size fits all solution. It's important to select a provider that has a visibility to all of the different options. So are there any non-hormone options to help with symptoms that you're, as you kind of get into that holistic look?
Sure. So a lot of women, when they come to me saying, should I be on hormones and why? And I sort of ask, well, what are the goals of your treatment? So is it primarily those vasomotor things I mentioned, hot flashes, night sweats? Mm-hmm. Is it things like my hair is thinning, which doesn't sound like a really big deal until you're that woman. Right. It's a really big deal for that woman. So you kind of have to look at which of the symptoms. Are we mostly worried about bone health? Is it mostly vaginal symptoms? We want to focus on that. So I think the first decision is figuring out, are you a good candidate for estrogen, progesterone, vaginal estrogen, or is that not even going to help the specific symptoms you're having? In which case, are there non-hormonal options that might target those things better? For example, there's all kinds of bone health medicines that work on just bones if they don't need the other things that the estrogen might do for them. Now, for the women who come in and they are not candidates for hormone therapy, so these are women with breast cancer, with liver disease, significant risk of stroke and heart attack, very specific blood clot risk, very specific health contraindications, and they are real and they are absolute no's for hormones. So somebody meets those, then I talk to them about this whole other category of non-hormonal options that in some cases are FDA approved, but a lot of times they're just other medicines that doctors like myself who do this kind of work, we've known for a long time that these medicines happen to help with some of these other symptoms. Yes. Sometimes we know why, sometimes we don't, but the overlap is such that you can take medicines such as Effexor, which is a medicine that's an antidepressant. You can take it even if you're not depressed, and it may very well help your hot flashes. I kind of explain to people that hormones are so complicated. They start in your brain and they affect your thyroid and your adrenals and your ovaries. And there's a lot of places where they interact and things can go wrong. But because they start in the brain, anything that affects brain chemistry ultimately can affect hormones. And so a lot of these medicines, even though they're not at all hormonal, they may work on the parts of the brain that have to do with your ability to control heat and the night sweats, that type of thing. There's even a new one that's getting a lot of attention. It's oxybutynin. Not a new drug. It's been used for a long time for overactive bladder. Many menopausal aged women are already taking it for that. But for women who aren't, we have now found that it's very effective for hot flashes, even in women who aren't having bladder symptoms. So this is what I'm talking about when you have to really comprehensively look at what other health conditions the patient might have. Can you kill two birds with one stone? Yeah. Kind of outside the box thinking for how can we address her symptoms differently.
I love that. And it sounds like this isn't just for women who are experiencing menopause, correct? Like this is, right. You can really look at a holistic look and understand that, truly, if you are, have questions or you want to learn more about this and you're curious, it starts with a conversation. So in the last few seconds that we have here, what's the best way for somebody to kind of understand if they're a candidate or at least have the conversation with you?
Ask your doctor. And if you aren't satisfied with the attention you're getting or the type of conversation, find somebody who really specializes in this kind of work. I tell women, a lot of women in their 40s, they they may not be anywhere near actual menopause. Typical age is around 52, but there's this menopause transition that on average lasts about 7 years. So women in their early and mid 40s start to feel terrible, and they come in and say, am I in menopause? Well, no, because you're still having periods, but it doesn't mean your hormones feel okay, and they may be in flux. It's almost like puberty in reverse. So things just feel really off. And there's a lot of symptoms of that. And there are situations where you could do birth control pills, but other situations where you could do menopause type of therapies and still adequately control their symptoms even before full menopause is
That's
attained.
incredible. And I just love that you're encouraging people to take autonomy over their health and to ask questions. And if you're dissatisfied, all of us have been there. We've been sent along saying there's nothing you can do about this. It's, not true. Let's start having a different conversation and understanding that life doesn't have to be this way. So thank you so much for sharing your wisdom here today. You can learn more about Dr. Sarah Bartlett at shop.wisewellnessfield.com. She's got a page on there for her work through the Christ Hospital. And we really appreciate your time today. If you have any additional questions on hormone therapy, the Women's Health Center and through Christ Hospital is really, truly one of the top leaders in the country. We encourage you to learn more at thechristhospital.com. Thank you so much, Dr. Bartlett, for being here with us today.
Thank you.
You've been listening to Well Within 10, a bite-sized approach to working on your wellness. You can find more episodes wherever you get your podcasts.